Hi, guys. So, you probably know someone who's been to rehab and you just don't know who they are. This goes along with the theme that you know someone who's an addict or an alcoholic and you don't know who they are. Unfortunately, there are a lot of uninformed views and opinions about what actually happens in rehab. One thing that we hear a lot, I remember in my first rehab, there was a client there who was talking about how his wife told him, "You get to go on vacation." Rehab's not a vacation. So I'd like to talk about what actually happens in rehab. Before we do that, first thing, I want to apologize for my voice being kind of crap. I did just get out of rehab, and while I was there, I got sick, cold or something, and everything else is fine. Like, I don't have any lasting congestion or anything, or fever or anything, but my voice still hasn't recovered. Also, anytime you want to talk about medical treatment, HIPAA comes into play. HIPAA, if you don't know, is a particular law. I believe it stands for something like health information portability, something, something. But mostly it involves privacy. And so there's a lot you can't actually talk about when you go to rehab, when you come out. Like, if I tell you somebody else's story and you're able to figure out who they are, I violated HIPAA. But luckily, in this video, I'm not going to be talking about any of that. But keep in mind, when people do talk about their rehab experiences, there are some things they can't tell you because HIPAA does limit what you can say about other people. You also have those rights. But when you're telling your own story, you do kind of waive those rights, sort of. So, what is rehab? Now, when we're talking about rehab, first thing we need to be clear, I'm not talking about physical rehab, where this especially happens with older people. They get a particular surgery and they go stay at a rehab facility, and that's there to help them recover from the surgery. They're going to walk around and do all sorts. That's not the kind of, we're talking about drugs and alcohol. That's the kind of rehab we're talking about. All right, so in order to understand where rehab fits, we really need to talk about what mental health services actually are. Now, the one most people are familiar with is going to be, having a therapist or a psychiatrist. Both of them give psychotherapy. They both have different goals. Your therapist is teaching you things like emotional regulation and helping you sort through trauma and stuff like that. Your psychotherapist is typically trying to determine what kind of medications you need, adjusting medications and stuff like that, because a psychiatrist is a medical doctor, a therapist is not. But to be a therapist, you still need basically a PhD. So there's still actually have the title doc. Right, so those are the ones people mostly know about. Then there's what I like to call the short-term hospitals. These are the ones where you stay 3 to 5 days, sometimes as many as 7 to 10 days. And these are the ones you go to when you're having some kind of mental health crisis. So when we were talking about defunding the police back in the day, we were talking about maybe not sending the cops to someone having a mental health crisis, sending a social worker, whatever. Whatever you think about that, fine, whatever. The goal is always to get that person into treatment, which is a short-term stay at a mental hospital. And what they do there is they try to stabilize you as quickly as possible and then get you out and into an IOP, which I'll talk about more in a minute. Normally, to get into a short-term hospital, it takes a significant crisis. You need to, suicide ideation is the biggest reason people get into these hospitals. I've been hospitalized twice. I know what it takes to get there. That's how it is. Then there are long-term hospitals, which are dedicated to various mental illnesses. So, for example, I probably qualify for a long-term hospital on depression alone, major depressive disorder. Normally, what you're going to see here, you're going to see like schizophrenia, bipolar disorder, borderline personality. There's a few others. And the way this is portrayed in media is completely wrong. The long-term hospitals, well, we'll get into that in a minute. So IOP stands for Intensive Outpatient Program. Now, you may be familiar with this with a friend of yours or a family member who had cancer and they got treated as an outpatient. They got treated through an IOP, but it wasn't a mental health IOP. It was obviously a cancer IOP. So IOP is designed for whatever the condition you have, whatever you're getting treated for. In mental health, IOP is typically something that you attend 3 to 5 days a week for 3 to 6 hours a day. If you're only there for 3 days a week, you might go 6 hours a day. If you're there 5 days a week, you might only go 3 hours a day. And they'll treat a number of various mental health conditions, disorders, whatever you want to call them. Mental illness is the kind of catch-all phrase that we use here. And then you have rehab, which is a long-term hospital that specifically treats substance use disorder. Now, you probably know substance use disorder under some other names. Alcoholism, addiction, addict is common. If you go to Narcotics Anonymous, you'll say, for example, my name is Dave and I'm an addict. Other words you might be familiar with: junkie, drunk. I like telling people I'm a drunk because that's fun. Not drinking. Drinking is not fun. Telling people I am a drunk is fun. Some rehabs will be what you call a dual diagnosis facility. So the first rehab I went to was a dual diagnosis facility. So they treated whatever other mental illness you had and substance use disorder. So they treated the major depressive disorder that I finally got diagnosed with, I don't know, somewhere around 2017. There was a guy there who was schizophrenic. They treated the schizophrenia. Bipolar disorder, borderline personality disorder, they will treat all of those. Now, the one I just got out of is not a dual diagnosis facility. They focus on the substance use disorder. I don't know how they would coordinate that with, like, if you're schizophrenic, I don't know how they would coordinate that with your regular doctor. Obviously, that's not an issue I have, so it wasn't something I had to deal with. So this covers, in general, the mental health services that are actually available. Now, if you go to a short-term hospital because you're feeling suicidal, they will try to put you into an IOP when you get out. You should probably do that. I did it for one of my hospital stays, and there's a story there I don't want to tell. Definitely not telling in this video. I did not do it for my second hospital stay. Before we go on, a question I have not been asked, but someone should ask me, is why do I think I'm qualified to do these mental health videos? And the answer is because of how much treatment I've been in. Technically, I've only been into rehab twice. I've been into 2 rehabs. But for various reasons, I've actually been in treatment off and on for 10 years. I had a family member, and that's the most I can tell you because of HIPAA. And because of that family member, I went through 2 treatment programs, with that person. Then I went through a third one on my own. And of course, I've been hospitalized twice. So if you count it up, that's 5 treatment programs. And then I went to rehab for the first time. I've been doing this for a while. Let's talk about the cast of characters. In a rehab facility, these are the people you're going to find. Obviously, there are therapists, and they provide you psychotherapy. They also facilitate the group sessions, which we'll be talking about more in a minute. Then we have BHTs. These are behavioral health technicians. They're the babysitters. They're the ones who check up on you. They do rounds where they go around, they carry a tablet, and all they do is they mark where they see you. And after they've gone around, they've checked everybody. If there's anybody they didn't see, they get on their walkie-talkies. They ask, does anybody have eyes on Dave? And then all the other BHTs who are there are going to immediately look around and try to find Dave. Being kind of a loner and enjoying my solitude, they had to look for me a lot, particularly in my first rehab. Second one, not so much. It was much smaller. It was much harder to hide from everybody. All right, then you have providers, they call them. There's your health provider, who's usually a nurse practitioner, who's going to go over, various medications. So when I got sick while I was there, I went to my health provider. She's a nurse practitioner. She gave me prednisone, some other things, amoxicillin, whatever. That person will typically also, if you need an antidepressant, they'll give you an antidepressant, that sort of thing. There are nurses. There's a medical station, they call it. But different rehabs implement this differently. It's basically where you go to get your prescriptions. You have to go there certain times throughout the day, and you take your pills. You have to take them right in front of them, because some of the detox pills they give you can be used recreationally, and people have been known to try to stockpile them so that they can use them recreationally. It's rehab. People are there because they're addicts. You also have, among the providers, you have a discharge planner. Sometimes they're called a case manager. This is the person who tries to figure out what you're going to do when you leave. So they're going to try to make sure you have a therapist, a general practitioner, doctor, family doctor, and they're going to try to sign you up for an IOP somewhere. Sometimes the rehab facility has an IOP. Maybe they've contracted with someone else, whatever, and they're going to try to sign you up for that. They don't really care as long as you get into some kind of IOP, or maybe you're not going to do one, whatever. Then there's a chef, typically a real chef, not just some random kitchen worker. The cooking staff tends to be kind of small. It's cafeteria style in the sense that everybody eats at the same time. And so the chef and whatever they have for crew has to have the meal ready at that time. There is other staff, cleaning staff, maintenance, stuff you expect for a facility. And of course, there are other clients. In a mental hospital, we generally refer to people as clients and not patients. And the reason for that is because there's kind of a stigma with any kind of mental health, mental illness, first of all. And secondly, mental health patient gives you a particular visual. Maybe you watched the Borderlands movie and you got to see some of that visual. Maybe you've seen some other movies. And so we usually just go ahead and call them clients. So I was a client because that removes the stigma and it makes it a more equal relationship. So that's what I'm going to use in this video. There is what I like to call the rehab cycle. I'm going to talk about this in a little bit, but it is common for people to go to rehab more than once in their lives. So the typical cycle, it starts with going to rehab. A typical stay is 30 days. 60 to 90 days are pretty common. Now, 90 days is a sweet spot where you get the most bang for your buck. After 90 days, the benefits start to drop off. Before 90 days, you can benefit by staying longer. A lot of studies have shown that people who stay 90 days, a huge percent of them will remain sober for an entire year. And this is so solid that my first rehab offered a money-back guarantee, where if you relapsed in your first year, it wasn't really a money-back guarantee. It was you got a free 30-day program or something like that. 45 days is fairly common too. The one I just went to, they can do a 90-day program and they like to do it, but 60 days is more common. I'm not really going to go into detail why, because it doesn't matter a whole lot. After my first rehab, I actually made it like 2 years. I got out in February of 2019. Now, if you remember what happened in 2020, you can give me a little round of applause for staying sober for as much of 2020 as I managed. I didn't really start relapsing until early 2021. And then it was... All right, so then when you get out of rehab, you typically go to an IOP for another 30 to 90 days. Probably what's most common is people who do 30 days in rehab, then 30 days in an IOP. But IOPs really vary a lot. I went to one that was 4 days a week, but the whole program finished in about 4 weeks. I've known people who would go to an IOP that would last 6 weeks. 8 weeks is kind of common too. So a lot of it depends on what you get. But the real point here is that this is usually arranged while you're still in rehab because it's part of your discharge planning, but sometimes it's not. And as soon as you get out, the first thing you have to do in the first couple of days you get out is go ahead and set up an IOP. Now, I still haven't actually done an IOP straight out of rehab. There are reasons for it, and I might still try to sign up for one this time. You should watch my update video that I shot after this one, but posted first. There's some more information there about me and my personal rehab journey. It is possible to do 90 days in rehab and then 90 days in IOP, and that's 6 months of treatment. It is possible. I don't really know how common that is. The other thing you do when you get out is you start going to meetings. If you weren't going before, you definitely start now. Going to meetings is lifelong because addiction is lifelong. So I'm someone who has to go to meetings at least once a week for the rest of my life, which is fine because I really don't like being around people, and left to my own devices, I will never leave the house, or in my case, I will never leave my van. And so having to go to a meeting once a week gets me out and actually talking to people, which is good for me. So the meetings we're talking about like Alcoholics Anonymous, Narcotics Anonymous. There are others. While I was in rehab this time, I learned about Cocaine Anonymous and Meth Anonymous. An interesting split that I just learned is that Narcotics Anonymous is not Alcoholics Anonymous. AA has the big book, and Narcotics Anonymous wrote their own book, but Cocaine Anonymous and Gambling Anonymous and so forth, they all use the big book from AA, which I found interesting. The AA has all these other spin-offs. But there are others. There's Smart Recovery. There's Refuge Recovery / Recovery Dharma. Those two are Buddhist inspired. Smart Recovery is science-based. Life Ring is secular and science-based. And there are also a lot of unaffiliated meetings. They're hard to find because they're unaffiliated, but they tend to be more tight-knit because they're unaffiliated, and they're hard to find. And then, of course, when you get out, if you don't have a therapist, you're supposed to see a therapist. A lot of people don't. Not going to lie. I don't have a therapist. I should definitely be looking for one. All right, so that's the structure of services. Now let's talk about what actually happens in rehab. What does it go on? What does a typical day in rehab look like? All right, first of all, you do get a room, to sleep in, a bed, typically with a roommate. Some of them are dorm style, where you might share a room with 4 or 5 other people. My first rehab, I had a roommate. It was 2 people in a bedroom. My second rehab, the one I just got out of, it was 6 people in a room. Now, your first week or so, you're considered in detox, and you don't have to go to groups. When you're in detox, well, we'll talk more about that in a minute. After you get out of detox, you're classified as residential, and now you have to go to groups. The groups are why you're here, after all. Now, typically, after 20 to 30 days, if you're still staying there, you're going to be moved to a new classification. My last rehab called it PHP, which stands for Partial Hospitalization Program. My first rehab just called it IOP. And they put you in a room, in a building called the supplemental housing unit. And the way the billing worked, you actually had to pay room and board for the supplemental housing unit, but you didn't pay for the IOP. Whatever. You can get another 30 to 60 days doing this kind of program. And they even have different groups for you to go to. All right, so let's talk about detox. Now, detox is the most restrictive classification. You have no privileges. The only thing you get is you don't have to go to groups. And the reason for that is because you're still out of your mind. You're in withdrawal. You're in physical withdrawal. If you've ever heard about physical withdrawal, that's what you're doing when you're in detox. So I've seen this in both rehabs, actually, where someone came in, they were an alcoholic, and they had a seizure right away, and they had to be carted off to an emergency room right away. Like they showed up, had a seizure, and immediately left. And then they came back after getting treated there, and they're still in detox. And obviously you're detoxicating, taking different medications to treat whatever the withdrawal is. Now, there are drugs to treat alcohol withdrawal. There are drugs to treat heroin withdrawal. But if you use stimulants like cocaine or meth, you're kind of screwed. Sorry. Also, contact with the outside world is generally cut off completely. So there's usually a phone policy where you're going to be able to get your phone at some point while you're there. During detox, you don't get it. They can't cut you off completely, because you still have rights. And so you can call your family or whatever. When you come in an intake, you provide the names of people who are allowed to call on your behalf and ask about your condition and so forth. And you can contact them. I don't know if they can come during visiting hours. You would have to check with a specific rehab facility to find out about that. So that's detox. After you're out of detox, you go residential, and obviously at this point, you have to go to group. Whatever phone privileges they have, this is when you're going to get them. Now, my first rehab, we got our phones from 7 p.m. to 9 p.m. I want to say it was all 7 days of the week. I honestly don't remember. That was 6 years ago. The one I just got out of, you got your phone Monday through Thursday, 5:30 p.m. to 9 p.m. Of course, you have to go to groups, and at this point, the BHTs check up on you about every hour. When you're in detox, they might check on you every 15 minutes, especially if you're under some kind of suicide watch. Not enough for them to send you to a short-term hospital, but enough for them to give you more attention, And then after that, typically 20 to 30 days in, they'll move you over to PHP. Different places call it something different, but it is the least restrictive of all of them. Group attendance is still required. Some groups are no longer required. There is a higher level of responsibility that is expected from you, and with it comes additional privileges. So the one I was just in, I got to have my phone all the time, as long as I didn't pull it out at certain times or in certain places. Typically, you're moved to a new housing unit, which is located off campus. The one I just got out of, they had a shuttle that would drive us up, but it was also in walking distance, so you could walk back and forth at any time. But while you were on campus, if you had your phone with you, you couldn't take it out unless it was during the phone time for people who were residential. This is also the point where you're generally expected to take more of a leadership role in your own treatment. You have to become responsible for your own treatment at some point. When you get moved into PHP, that's when they start basically making you be responsible for your own treatment. Right. So what are the groups I'm talking about? Now, rehabs are always heavily oriented around group therapy. I assume other long-term mental hospitals are also heavily oriented around group therapy. There are basically two kinds of groups. There's a processing group and an educational group. Now, in processing groups, these are designed to deal with specific issues that you might have. They're always led by a therapist, and because you're in group, talking about your issues in a group, other people can chime in, they can help, they can provide support. They can also chime in with their own issues that are similar to yours. So, for example, we had a guy who was dealing with the loss of a really close member of his family, and when he started talking about that in group, several other people had lost people who were close to them, and they were able to talk about those, and we're able to process that sort of thing as a group. Now, for me, I have someone that I lost about 10 years ago now that I'm still dealing with. I was able to work on that without having to bring it up in group by participating in the group for everybody else who had lost somebody. And so this is the kind of thing that can happen in a processing group. There's lots of layers to the level of treatment you can get in a processing group, and they are a critical part of the process. Then you have the educational groups. And in these groups, they're more like class. And so it's common in rehab to refer to a group as class. Like, you need to go to class. Class starts at 8:30. Class starts at 9:30. Class starts at 11. Whatever. You need to be in class. If you're not in class and you're outside smoking cigarettes, the BHD is going to come along and say, you need to get to class. The reason we call it class is because of the educational groups. Stuff actually gets taught. And these are oriented around specific topics like grief, emotional regulation, healthy relationships, things that you need to know. At least one of these groups every day is going to be led by a therapist. And this is where, if you're doing like a DBT thing, which is dialectical behavioral therapy, there's a significant educational component for DBT. And this is the kind of group where it would be taught by a therapist. My first rehab was DBT based. My second one was not. They were CBT based, which is cognitive behavioral therapy. It's an unfortunate abbreviation, CBT, but there it is. But there are other educational groups which are not led by a therapist. It's common to have like a wellness group, which is usually led by a nurse, but not always. My most recent rehab, the wellness group, was led by, let's just say it was someone without any medical training. And the fact that she was able to have that job suggests that I'm not going to go into it. I did really appreciate the work she did. She worked harder for me on my recovery than anybody else there did. Like, she worked really hard. Anyway, there's a wellness group. Then there's often a health group where they teach things like, how does diabetes work? Or we actually did CPR training. You know, they had the dummies, they had and all that. It was great. You have probably heard about the arts and crafts group. There tends to be one. My most recent one combines that with the wellness group. Arts and crafts can be led by anybody. It's usually a nurse or a BHT. Then there are step groups where they tend to focus on the 12 steps. Not every rehab has these. My first rehab didn't have them at all. My second one, it was like once a week we did a step group, and that was led by a BHT. Then there can be game groups, which are topic oriented. And this will be things like, it's always a recovery topic, but you'll play games. Like maybe you'll play charades or you'll play some version of Jeopardy. Jeopardy is actually a pretty common one. And it's like a fun way to learn something, still an educational group. So let's talk about how the billing works, because ultimately someone's paying for this. When you're required to attend a group, it's because your insurance company is paying for it. So if you don't attend, your insurance company is not going to pay for it. If the rehab facility isn't going to make money from you going to group, they'll kick you out. It sounds like they're just being greedy, but they're not. They got bills to pay, just like all of us. And if they don't pay their bills, they can't provide the treatment. And if they can't provide the treatment, people don't get treated. And this is a matter of life and death. This is not, I'm going to go to rehab and I'm going to learn how to be a better person and my life's going to be a little bit better. No, this is, if you don't go to rehab and you're in active addiction, you're going to die. So we need the health insurance companies to pay for you to go to group so that you don't die. But this does bring in some interesting problems. For example, you can't actually be required to attend groups that your insurance company doesn't pay for. Now, when you're classified as residential, your insurance company pays for all of those groups, the health group and the wellness group and arts and crafts and all of that. But once you get moved over to PHP, they only pay for groups that are led by a therapist. And if you know that, you can use that information to get out of groups, but you should attend all the groups. You get the most benefit by going to the groups. The BHCs hate it when you know that. Sorry, if you're a BHC watching this, I just gave away information you don't want clients to know. But the reality is that all the groups are helpful. And it's not just that they're helpful. It's common to have like a particular topic. Like on Saturday, we're going to do healthy relationships. And then every single group is going to attack the topic from a different perspective. And you need all of that. But one thing that came up this last time, in my first rehab, okay, so they have meetings in the evening after dinner. These are what they call H&I, something in institutions. I don't remember what the H stands for. But it's people come in from the outside to have a meeting. So someone from Narcotics Anonymous will come in and have a Narcotics Anonymous meeting there. This is how I found Refuge Recovery in my first rehab. Refuge Recovery came in from outside and they had a meeting there. And then later, after the Refuge Recovery Dharma split during the pandemic, I was one of the people who went in to have the meeting. But at that point, it was all Zoom, so I did it on my phone. A friend of mine, she was the contact for that, and she invited me as a guest speaker, and it was great. They might tell you the meetings are required when you're residential, but they can't actually require you to go to the meetings because your health insurance company doesn't pay for anything that is not actual medical treatment. And because the courts have decided that AA and NA are religious organizations, they can't require you to attend those. Your insurance company doesn't pay for them, but you should still go. I actually skipped most meetings. During my second rehab, I made a friend. right away. Like my first full day there, I made this new friend, and she wanted me to go to the meetings with her. And so I went to every meeting that she went to, but I didn't go to any meetings she didn't go to. She discharged before I did, and I quit going to meetings. Meetings in rehab. I'm going to be going to meetings now. Don't worry. All right, so let's talk about the client's journey. Some of this is autobiographical, my own experience. Some of it's from watching other people and talking to other people. Typically, when you first get there, you feel shell-shocked. For my first rehab, that was because the way it happened, I couldn't believe I was actually there. I didn't think I belonged. I wasn't an alcoholic. I only drank at night. But what had happened was I was watching Angel in the middle of the night. You know, Angel from the Buffy the Vampire Slayer, the spinoff. And I was watching it on Hulu, and a commercial came on for American Addiction Centers, and I called the phone number. It was like 3 o'clock in the morning. I called the phone number. I was laughing. I was like, I'm not an alcoholic. I don't hide my drinking. Everybody knows when I'm drinking. I'm not an alcoholic. And I talked to them, and then about 20 hours later, I was on an airplane flying out to Tampa. And then you get there and you feel the weight of everything that has happened coming down on you. And you're like, holy crap, what am I doing here? Do I belong? I think I belong. They say I belong. And it's all new, and it's just shell-shocked is the best way I can describe it. And this happened on my second rehab too, and this was different because I knew I needed to go. I had been, back when I moved into my van, to watch the RV conversion videos. When I first moved into my van, I made a deal with myself that because I couldn't go to rehab before that, and I was in a relapse. And I couldn't go before that because then I wouldn't be working, and I wouldn't be able to make money because I was paid hourly. I wouldn't be able to pay my rent, and I would lose my home. Well, then I lost my home for completely different reasons, moved into a van, and I was like, I'm going to go to rehab. And then I moved in my van and I was sober for the next 6 months. And of course, I'd already started this channel. And so anyway, I went to take my vacation at the beginning of December, and I was relapsed again at this point for like a month and a half or so. And I was like, okay, I'm going to sober up on my vacation and everything will be fine. And then the first week I spent drinking. So I said, well, it's time to go to rehab. So I called. I was drunk when I called. That's common. And then I drove down the next day when I wasn't drunk. I did not drive drunk to rehab. And I drove down there and I was like, and I got in there and I still had this shell-shocked feeling. It was different because now it's like, damn, I'm here again. Why am I having to do this again? And of course the answer is because it's a chronic medical condition and one rehab isn't necessarily enough. Cancer comes out of remission and people have to go back to the cancer ward. Addiction comes out of remission and you have to go back to rehab. That's why I was there again. So after the initial shock wears off, you start accepting where you're at and you start going to groups and you start meeting people. Now, most people tend to be kind of quiet during the first week. You're surrounded by people you don't know, and whatever processing you're going to do of your own issues, you're usually going to piggyback on someone else's. That's why the processing groups are done in group. And at some point, you're going to start asking questions that are specific to your own life, and you're going to start getting more personalized treatment for yourself. Now, during the early stages, when you're there, the first week, maybe 2 weeks, most of your actual treatment is being fueled by the educational groups where they're teaching emotional regulation, how to deal with grief, relapse prevention, that sort of thing. And one thing you'll see is that the more a person participates in groups, the faster the treatment works on them. So if you go to rehab, participate in the groups. Don't try to isolate yourself while you're in groups. And then at some point, and this is what you're looking for, there's a turn the corner moment. You can't see it while it's happening, but you'll see it after you've done it. And at this point, you're actually in recovery. But being in recovery means you have very few or no cravings. You're more in touch with your feelings, or if you're a logical person, you'll be more in touch with your feelings. If you're a feeling person, you're more in touch with your logical mind. We call this the wise mind. There are a few other things that characterize recovery, but recovery is more, being in a state of recovery is more than just being sober. For me, it means the depression is gone. And then typically you still have another week or so that you're going to be there. In a 30-day program, you might be doing a longer program. And you're trying to consolidate your gains. If you're in a longer program, you're actually going to dig deeper into your issues, which is one of the reasons a longer program works more effectively. And then when you come out of rehab, you have all these life changes you need to make. Some of them you can make while you're still there. Usually not many. But so when you come out of rehab, you're ready to make some serious life changes. And the most common ones, you're going to cut off your toxic friends and family completely, or maybe some of them you can't cut off completely, so you're going to love them from a distance. I tend to very aggressively cut off toxic people. You're going to change jobs jobs if you need to. If you're married, you're going to do some marital counseling. You're going to find a regular meeting to attend at least once a week, although a lot of people fresh out of rehab will go more often. They'll go 3 to 7 meetings a week. There is a phenomenon where they talk about going to 90 meetings in 90 days. I believe I talked about that in my AA video, so if you want to know more about what I think about that and how bad of an idea I think it is, watch that video. All of these life changes are designed to reduce your stress to a manageable level and to set up healthy boundaries so that your stress never becomes unmanageable. Most people fail to do this right the first time, but you're kind of on a race because you come out and you have all this momentum and I'm sober and I can kick anybody's ass or whatever. And you need to set up your sober life and live it for a while before the shit hits the fan again and you find yourself drinking again. That's the challenge when you get out of rehab. Right, so what did I get out of rehab is a good question. Now, in my first rehab, I wrote a book. It's called Ghost in Time. I didn't finish it. It was in a rough draft form, which meant there were a lot of places where it said to do, write this, blah, 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 some notes. Places where I had conversation but no narrative. It was a rough draft. Also, I knew my marriage was over. What I mean by that is I knew what needed to change. I knew what I had to do. I had pretty good ideas what she had to do, and I was prepared to do what I had to do. The fact that that marriage is over should tell you what happened there. I also understood that addiction is a disease with no cure and that I had to make treatment a way of life. I have mostly done that since then. I also had a pretty good practice of using various skills to keep cravings at bay, not just to stay sober, but to be healthy. And my depression was gone, and I was mentally healthy. Now, I got out of rehab in 2019. You remember what happened in 2020? I got divorced in 2022. Take a wild guess what happened. Obviously, I went to a second rehab. Beginning of December 2024, I got out early January 2025 when this video was made. My depression is gone again. However, as of shooting, it is a running battle. I only did 30 days. I'm going to be okay. Don't worry. During the last about 3 years, I have been aggressively terminating toxic relationships. There is one more I needed to get rid of, and I'm working on that. I have mostly ended that relationship. I have established some new relationships, and I know I need to orient my life around them. I needed to quit my job. I figured that out. I was planning on going back to work and then figuring out what I was going to do. Now, if you watch the update video, you'll see that I didn't get to do that. I actually got fired. So, fine. I don't have to figure out what I'm going to do next. Rather, I have more time to figure out what I'm going to do next. I also have less time because I'm running out of money. I did finish the draft of Ghost in Time. And what I mean by that is, it's finished. 90% of the words that are written in this book are in their final form now. What I have to do, when I first wrote it, I was still married. And so while I was talking about that relationship in this book, I'm going to say I participated in the cover-up. If you've been in an abusive relationship, you know what that means. And so when I was writing about that relationship in that book, I didn't go into details. I'm going to fix that. Also, I have a bunch of people who show up during the action-packed finale who didn't get an introduction earlier in the book. I need to add those. Those are the 2 things I need to do to finish this book. Then I'll do a round of revisions, send it out to pre-readers, do another round of revisions based on pre-reader feedback. Then I have to do a style edit because I don't have the money to hire an editor to do that for me. Then I need to do the cover. I don't know, maybe I'll have it done by the end of March. Maybe it'll be done by the end of January, probably not, but we'll see. I really want to publish this book. And then all 3 of the situations that led to the relapse that put me into rehab, one of them, what was going on at work, I just had to wait. That got resolved on my 3rd day out of rehab when I got fired. That situation's over. One of them that I don't want to go into detail about, I did resolve that while I was in rehab, and I'm moving forward. The 3rd one was that friend, and it's basically resolved at this moment. All right, so the schedule for groups is typically something like 8:30 a.m. to 4 p.m. It can be 8 a.m. to 4:30 p.m. I mean, it's a whole work day, and it's 7 days a week. So I mentioned this idea that rehab is seen as a vacation. What vacation do you know of where you are going to work from 8 a.m. to 4 p.m.? That doesn't sound like a vacation to me because it's not a vacation. However, facilities do tend to have some resort-like features, but it's still anything but a vacation. Now, when you're not in group, 8 hours a day, 7 days a week, you're still talking about your problems with other clients, sometimes with BHTs. You might be in therapy with your therapist, whatever. You're talking about your drinking or your drug use, and you're making friends that have similar experiences. You're processing trauma with these people. You're processing whatever shit's going on or has happened that led you to be an addict in the first place. It can be so grueling, in fact, that a lot of people who are ex-military that go to rehab, they liken it to boot camp. That's how rough it can be, especially if you embrace the treatment and you really work at it. It's a lot like boot camp. The schedule is relentless because addiction is relentless. Addiction doesn't take a day off, so treatment doesn't take a day off. There are people who try to skate through rehab. They always relapse. And there is always drama. It's a mental hospital. Everybody there is mental. I'm mental. That's why I was there. Of course there's drama. And because of the way the programs work, you always have new people coming in and people cycling out after completing treatment. At least once a week, someone leaves against medical advice, which is called going AMA. And they usually relapse. It's also fairly common to see someone who left a few weeks ago come back. I saw a few people like that in my first rehab because I was 90 days in my first rehab. So anybody who finished the program when I got there and came back while I was still there. It's not a one-size-fits-all experience, and there's absolutely no guarantee you will be fixed in one trip. This is something that a lot of family members think is going to happen. You're going to go off and get treatment and you're going to come back and be perfectly fit. No, actually, the family dynamic needs to change. The whole thing needs treatment. That's why when I mentioned my first two experiences with treatment that were not rehab with a family member, the whole family needed to be treated. Rehab is the same, but you don't bring your whole family with you. You just go. Now, when you're in rehab for drugs, you are treating a chronic medical condition. It is lifelong. And so probably the second most common question asked in rehab is, how many rehabs have you been to? Because chronic medical conditions require chronic treatment. And that includes going inpatient whenever needed. And for all this, it is usually a life-changing experience. And lives are actually saved. Although sometimes it can feel like they aren't. But without my first rehab, I don't know if I could honestly tell you I'd still be alive right now. I don't know. So that's rehab. And if there's any takeaway I really want you to get from this video, I want you to understand it's not a vacation. It is hard work, and it is life or death. Treating addiction isn't a walk in the park. It is very much like treating cancer. If you don't get the treatment, you will die. And I would really like you to have that takeaway. But I would also like you to understand, just kind of have an idea of what people who are in rehab are actually doing. So that when someone comes up to you and says, hey, I've been in rehab, I go to meetings now, you'll have an idea what their lives are actually like. And you might be able to do a better job being supportive. Bye, guys.